Did you know your heart can be in danger even when you feel perfectly fine? A lot of people believe that only those with chest pain or shortness of breath are at risk. But the truth is, most heart attacks happen without any warning. These are silent diseases that build up slowly and only show a sign when your body is crying out for help. The problem is that even with all the technology available, a large portion of people have never had a complete heart checkup. And what's most frightening is that studies show that up to 80% of heart attacks could be prevented if these tests were done at the right time. These 5 tests I'm going to show you today reveal what's happening inside your heart before symptoms appear, and they can literally prevent a small problem from turning into an emergency. So, stick with me until the end, because the last test on the list is the most overlooked, but it's the very one that could save your life. Before we continue, do me a favor. Go ahead and leave a like and subscribe to the channel, because this information could truly save a life. The first step to understanding if your heart is in danger is to look at your blood. It's like a biochemical mirror of what's happening on the inside. Simple tests like total cholesterol, LDL, HDL, triglycerides, and blood sugar show if the body is accumulating fat in the arteries or producing more glucose than it can handle. When bad cholesterol, the LDL, is high, and good cholesterol, the HDL, is low, this accelerates atherosclerosis, the silent process where the arteries gradually narrow until they block blood flow. And that's when the risk of heart attack and stroke increases, even in people who feel perfectly healthy. In addition to the lipid profile, uric acid, high sensitivity C-reactive protein, and a complete blood count also help measure chronic inflammation, which is now considered one of the main cardiovascular risk factors. In many cases, the blood shows early signs that the body is struggling with insulin resistance, abdominal obesity, or oxidative stress. These are changes that, when treated in time, can be reversed. It's the kind of test that should be done at least once a year, even in young or seemingly healthy people. What's most interesting is that these changes usually appear years before the first symptom. In other words, your blood gives you a warning before your heart even complains. And if the blood test reveals a chemical risk, the next one shows what's happening anatomically. It can see inside the arteries and the heart itself in real time. Have you ever heard someone say, "My heart feels tired"? Well, sometimes that phrase is more literal than it seems. The electrocardiogram and the echocardiogram are the tests that show if the heart is truly working well, even when there are no symptoms. The electrocardiogram records the heart's electrical activity and can identify arrhythmias, stress on the chambers, and signs of ischemia, which are small failures in blood supply that precede a heart attack. And what's most interesting is that it can detect this in just a few seconds in a completely painless and accessible way. Now, the echocardiogram is the test that turns the heart into an image. With it, the doctor observes the heart muscle in motion. He evaluates the function of the valves, the pumping strength, and the blood flow. Subtle changes, like a dilation of the left ventricle or the thickening of a wall, can indicate poorly controlled high blood pressure, early heart failure, or even valvular diseases. These findings, when discovered early, allow for adjustments to medications and lifestyle habits before the problem progresses. This completely changes the prognosis. According to the Brazilian Society of Cardiology, up to 70% of patients who have a heart attack had never had a complete cardiac evaluation. And if these tests show the heart's behavior and structure, the next one on the list goes even deeper. It analyzes the body's plumbing, the arteries that carry blood to the heart and to the brain. Imagine your arteries are like the pipes in a house. Over time, if the water flow carries a lot of grease and impurities, these pipes will narrow until they almost close up. This is exactly what a Doppler of the carotids and peripheral arteries shows. They allow us to see in real time how blood flows inside the arteries, identifying fatty plaques, the so-called atherosclerotic plaques, before they cause a blockage. These plaques are responsible for a large portion of heart attacks and strokes. And the curious thing is that they form silently over the years. The carotid Doppler analyzes the arteries in the neck, which carry blood to the brain. And when there's a narrowing called stenosis, the risk of stroke increases significantly. The lower limb Doppler, on the other hand, reveals the state of the arteries in the legs, showing circulation problems, old thromboses, blockages, and calcifications. These findings don't just affect the legs, they reflect the state of the arteries in the entire body, including the coronary arteries. In other words, if the arteries in the legs are compromised, the heart probably is too. According to studies, someone who has peripheral arterial disease has up to a 4 times higher risk of heart attack and cardiovascular mortality. The good news is that the Doppler is simple, fast, radiation-free, and completely painless, and it shows the health of your arteries with impressive precision. And if this test evaluates the body's flow and plumbing, the next one reveals how your heart reacts when it's put to the test. It's the test that shows if it can handle the pressure. Have you ever noticed that many problems only appear when we're put to the test? With the heart, it's the same thing. The exercise stress test, also known as the stress test, evaluates the heart's performance while the body is subjected to a gradual increase in load, usually by walking or cycling. During the exam, the doctor monitors your heart rate, blood pressure, and the electrocardiogram tracing. The goal is to see how the heart reacts when it needs to work harder than usual. This exam is essential for detecting silent ischemia, when blood flow to the heart muscle drops during exertion, but without causing chest pain. These subtle electrical changes can be the first signs of coronary artery disease, long before a heart attack occurs. Additionally, the exercise stress test helps evaluate physical fitness, blood pressure response, and exercise-induced arrhythmias. This is valuable information for both those who exercise and those who need to start safely. In many cases, the exercise stress test is the dividing line between what seems healthy and what is truly healthy. It shows that the heart is prepared to handle the stress of modern life, whether it's physical or emotional. And if this test reveals the heart's behavior and action, the next exam on the list shows the metabolic picture that fuels this engine. It's the one that measures the levels that most influence the risk of heart attack and stroke, the glycemic profile, and kidney function. Before we continue, do me a favor. If this content is helping you understand your body better, leave a like and subscribe to the channel. That way, you won't miss the next videos on preventive health. And you'll also help this information reach people who can avoid a more serious heart problem. It's no use having a strong heart if the fuel that feeds it is out of balance. Metabolic and kidney function tests are essential for understanding the backdrop of cardiovascular diseases. Blood glucose and glycated hemoglobin reveal if there's insulin resistance, which is the initial stage of type 2 diabetes. This condition is one of the main causes of atherosclerosis and myocardial infarction, even in those who don't yet have a diabetes diagnosis. Meanwhile, creatinine and urea show how the kidneys are functioning, which have a direct link to the heart. When the kidneys start to fail, the body retains fluid and blood pressure rises, forcing the heart to work at its limit. Additionally, microalbuminuria, a simple urine test, can detect early vascular damage long before symptoms appear. It's a silent warning that the circulatory system is under pressure. These tests complete the cardiovascular risk puzzle. They reveal whether the body is in metabolic balance or if the heart is being overloaded day after day. When evaluated along with the other 4 tests, they allow us to create a precise map of cardiovascular health, showing where to act before something happens. And that's where the big secret comes in. Prevention is always cheaper, simpler, and more effective than recovery. Taking care of your heart isn't just about avoiding a heart attack. It's about ensuring it keeps beating strong for a long time. These tests are simple, accessible, and can make all the difference in your health. Leave a like, subscribe here to the channel, and tell me in the comments, when was the last time you had a heart checkup?